This trigger film was developed for health services to use as part of an experience-based co-design process, EBCD. EBCD is a patient-centred quality improvement process. The film is intended to get local people, patients, families and NHS staff talking together about how they can jointly improve people's experience of health services. You can find out more about this process and how to use trigger films by accessing this link to the EBCD toolkit. This film draws from a collection of 40 interviews with people with type 2 diabetes. The interviews were conducted across the UK by the Health Experiences Research Group at the University of Oxford. It includes people talking about their experiences of being diagnosed with type 2 diabetes, talking to health professionals, about treatment and management of the condition, about diet, exercise and lifestyle issues, support and information, and accessing care. The full study can be seen on healthtalk.org. We'd like to know more about how you used this or other trigger films in the collection, and would be grateful if you would spend a few minutes completing the feedback form. The link to this is on this page.
Symptom-wise, again, going back to what I said earlier, my ones were going to the toilet, thirst and tiredness. They're the three and I believe they're the three most common ones. And I think I probably had it for quite a few years without knowing about it, because I was, feeling tired. Even I would say towards the end of when I was going to university, you'd come back really tired and stuff, and you would just think, oh, because I had a late night or whatever, but it was too frequent. And going to the toilet was a big thing. But as soon as the GP diagnosed it, it was a bit of a shock initially to the system, because you're told you've got quite a serious condition. So there was the shock element as well, that I've got something wrong and I've got to obviously be careful now and watch what I do and take all this medication.
I don't like having it. I don't like having diabetes. But I'm sure there are lots of people that don't like having the conditions that they've got. But we come to terms with it and start to get on with life and deal with it as best we can.
Is that because it's a label of an illness, or is it specifically diabetes, or?
I think, like I said before, it's an imperfection, if you like, in some ways, and that not ever having had any real conditions before on sort of minor bits and pieces, then suddenly I'm told that my body's not working perhaps in the way it should do.
It's the initial shock of somebody coming to you telling you you're diabetic, and you get over it. You sort of sinks in with you eventually, but it is initial shock, and you do think, oh, I'm the only one at that specific time. But you will, once you sit down and sort of think about it and settle your mind into it.
I can't remember being told much about it. It was just told that, okay, they sort of went on to the medical jargon, and telling me about the sort of like the physics behind it all, or the biology behind it all, and I just didn't have a clue what they were talking about. All I heard is that I've got this thing, and it was irritating me at that time, because it had stopped me doing what I'd initially gone to the hospital for. So I was just irritated more than anything else, and I don't think I really got at that time that much information. It was, like I said, it was more like the biological reasons why one would have diabetes, but it wasn't, which I think I just needed someone to sit down and explain the impact that it could have on your life if left, one, untreated, secondly, neglect of your eating habits and things like that.
I know that generally speaking my GP was very good, was very calming, explained everything to me several times, was very reassuring, but I can't remember any of what he said hardly, apart from the fact you've got diabetes, you know. I think looking back that I was actually in shock. So basically, what he had to deal with was a 51-year-old that was diabetic, where my HbA1c was very high. He said that the way I was going on, within 2 weeks I'd probably have collapsed and been taken to hospital. So he said, we need to get this under control. And he said, we need to bring your blood pressure down, we need to sort out your cholesterol. So it was take a statin every day, take an aspirin every day, that'll start helping the blood. There's a blood pressure tablet to take every day. And then for the diabetes, there was a metformin and a glycoside. So it's then off clutching my prescription off to the chemists, where I was sort of pretty shocked about, shell shocked I think, and the chemist sort of looked at the prescription and said, oh, newly diagnosed. And I said, yes. So the pharmacist asked me to sort of go into the little room that they've got, and just sort of said lots of reassuring things whilst they were preparing my prescription. You know, don't worry about this, you know, it's not the end of the world. Diabetes is something that lots of people have, you know, just be a little bit more careful about what you eat and just take the tablets, and you can lead a perfectly normal life. Don't worry about it, which I thought was actually cheered me up more than anything else, to be honest.
Well, I mean, I've been with my doctor for years, so we've got a good relationship. He just said to me, look, I'll tell you straight what the situation is and what you have. This is what you have, and these are the risks that are involved with it. These are the possibilities. So he just laid it all on me, and if I had any questions, I asked him. And he says, and of course with the subsequent visits that we had, whatever questions I had, I would always ask him, and then he would answer me, you know, straight up, and we just took it from there. So it was a pretty intense download, as it were, and upload on my part. But I think it helped me because it hit the message home, and his concern was that, you know, I get into the groove of things quickly enough because my sugar levels were that high. So he was anxious that they come down as low as possible, as quickly as possible. So I think it helped me as well in coming to terms with it quickly enough.
And is there anything that, looking back, you feel worked particularly well for you?
My GP being letting me take control of it, or not control of it, but not, I mean, I said to him in January, I want one last try to get these under control. And he said, okay, but you've said that before. And I said, no, I really mean it this time. I will. And then if I don't get it under control, I will start insulin. And you could put that on my card, that I will do that. And he let me do that, you know, without, and he hasn't pressured me into stuff that I didn't want to do. It's been negotiated. The increase in medication has been negotiated. I said to him about the atenolol, coming off the atenolol when my blood pressure went down, and he said, oh, I don't know. Oh, all right, then we'll give it a try. So he responds to my requests, and if my bloods continue to stay the same, I shall ask if I can take lower doses of the metformin, and I'm sure he'll let me if he thinks that's, you know, if that's okay, as long as I monitor it. So there's a lot of, I think, for me, I'm glad there's a lot of self-monitoring, and you have to take responsibility for it yourself, because it is a lifelong, day-long condition. It's a 24-hour condition. You can't just take your medicines in the morning and expect to go through the whole day then just doing what you like.
At the diabetic clinic you always see different people, so I never you know, the doctors, I don't think I've seen the same doctor twice, I don't think. So I wouldn't say you have a sort of relationship there, really. Although I do see regular people at the podiatrist, and they're very good.
Talk to me about podiatry. What works there?
I think it's because as soon as I've got a problem, I just have to ring up, and they know that I'm not just, you know, they know it's genuine with me, and they know that, you know, I really have got a problem if I'm ringing up. So they see me straight away. They always do, and they're very straightforward, and they're very direct with the advice they give me, and they it's all common sense. And I mean, for instance, like, all the time I had the dressing on my foot. I mean, I did the dressing on my foot. I had to dress my foot myself every day, twice a day, for a year, and they were fine, you know, about that. I never felt like, you know, I wasn't doing it right or whatever. You know, I always felt okay about, you know, everything that I was doing. So that was good.
I'm glad I stuck to my insulin. I think changing to insulin is the best thing I ever did. A lot of people are scared of the needles, but they're not that actually they're not that scary. It doesn't hurt. Okay, your belly might end up bruised. I'm in the process of, my nurse wants me to do my leg, which I don't want to inject my leg. I don't mind my belly, but I don't want to inject my leg. But diabetes is a lot better to control, I feel, with insulin rather than tablets, because the thought of having metformin and the pains you get, whereas you get no pain with insulin.
If I could just say, my father's recently been in hospital last week or so, very ill with an infection. He's diabetic, and I actually said right at the very beginning, he's diabetic. You know, you must watch his sugar levels, you know, because he wasn't eating and whatever. One morning I went in to see him, and he'd had a hypo, and it had to be brought back very dramatically from a hypo, and they were treating each symptom as it came, and he was on a general, I think it was on a surgical ward maybe, but they didn't seem to, the nurses even there didn't seem, they knew what to do with somebody who was having a hypo. I mean, no problem at all, but it was like preventing it. And then it was like, I said, can he have a biscuit, a digestive biscuit, last thing at night, and can there be one by his bed for the first thing in the morning? And it was like, oh yes, we can do that, you know. But it was like, now you know, everything else about the care was fine, was fabulous, and that wasn't a problem because they were there and could, but he'd been must have been in a hypo for most of the night, because it was overnight, and it's like, ooh. And so I just worry about the general knowledge of nurses who are dealing with diabetes, because actually if the population as a whole, the diabetes is becoming more prevalent in the population, is it something that nurses need more training on? And doctors, I mean, he was dealing with urology surgeons, so, you know, but it's about care, and it's, you know, I mean, there was no problem, and they then put diabetic above his bed in big capital letters, but it took an incident. So that's not about me, that's about him. But if you know what I mean, it's sort of, how did it happen? Or is it something that happens all the time? And it's, you know, you can only treat the symptoms as they occur. I have asked on several occasions to see a nutritionist, to be told that they don't really exist in the NHS. They are dietitians, and it's the same thing. I would dispute that it is the same thing. My understanding is that nutritionists are maybe have a different depth of knowledge. The ones that I've known have had doctorates, have done nutrition as a PhD, and I'm just I don't know, maybe I'd like to be able to talk to somebody more about the nutritional value of food, rather than this is a good food, you know, this is what you need to eat as a diabetic. I just need a little bit more in depth, and I've been meaning to make an appointment to see a nutritionist privately, because you can see them privately. But I'd just like to know why they don't have nutritionists in the NHS, and if there is a difference. I mean, I do believe that nutritionists see themselves as something different from dietitians. I found that when I went to see the dietitians, lovely women, but had no concept of my lifestyle.
I don't have many vices in my world, and probably my only vice was a really good packet of licorice all sorts, or a really good meal. That was, you know, the two things I really liked. And annoyingly, there's a lot of help with people whose, you know, their vice is alcohol, or there's lots of drugs and lots of free treatment. If your vice is smoking, there's lots and lots of different ways of getting off smoking prescribed to you, and special nurses employed by the PCT, etc., to help you out with all this sort of stuff. But if you eat too much, your only option really is to go to a place with a load of middle-aged women and talk about how many pounds you lost, and over a pat lunch, which is the most. I tried, I did it, but it was just like nobody else is from my world in this room. Nobody else gets what my world is about here. This is just bizarre, and I just ended up being mothered by 30 middle-aged women, which was really quite depressing. And so that was that really.
With me, I'm always, I don't know what it is. I'm always somebody, I'll say, okay, right, what I want is, because I think I'm just so, I'm busy trying to control my life, and it's just so out of control. I like structure. I want structure, and I want someone to say, eat this on Tuesday, that on Wednesday. If I feel that would work for me better than just, well, you know, you can eat so many hours, you know, I'm somebody who needs, that's why I'm always watching these. I need someone that, I don't know about Gillian McKeith, but I need somebody who's sort of like, right, this is your diet, this is your sheet of what you're going to eat for today, yeah, and tomorrow it's going to be like this, and you sort of weigh out and you put that's me, but I can't do that myself.
I'm going to a weight clinic now, apparently. I call it a fat clinic, but it's the weight clinic. The nurse I saw yesterday was absolutely brilliant. First time I'd met her, I was a little bit apprehensive. Late going in, I thought, oh, I'm going to leg it. I can't go through with it. But I did go in, and I was glad. Yeah. And the word obese come up on the computer. She said, I want you to ignore that word. She said, it's the most horriblest word ever. Because, you know, like, it's how they describe you in it. Like if you're over such and such a weight. But we were laughing about that. But she was alright, very good.
Then there was a bit of conflict between the consultants, because the diabetes consultant kept saying, please make sure you get plenty of fibre in your diet, have wholemeal bread, have plenty of nuts and things which will be slow release of energy and will keep your sugar down. Go next door to the colitis man who would say, whatever you do, don't have fibre, because that'll upset your stomach. Don't have brown bread, don't have this, don't have the other. So it became a balance between the two of them. So eventually the dietitian diabetic nurse and I sat down, and we had a long talk about it, and we came to an arrangement whereby we've come up with a programme which is pleasing to both sides.
Do they involve you at all when they discuss this?
Well, yes, they don't talk to each other, they talk through me.
Okay.
So I go to one of them and say, Dr. X said I should eat lots of fibre. Oh, no, you shouldn't. So next time I see Dr. X, Dr. Y said I shouldn't eat so much fibre. I don't care what he said, you need to in order to have slow release energy, otherwise XYZ will happen. So I go back to the other doctor. He said XYZ will happen if I don't have fibre. Yes, but if you have fibre you'll then find that your bowel does ABC. So I go back to the other one and say, he says my bowel will do, but does ABC matter? Does it matter that you're running to the toilet as long as your kidneys are functioning properly? But what if my kidneys, what if going to the toilet with my bowel problem, say, oh, it won't upset your kidneys, it'll only upset your bowel. Because the two are not related. Your kidneys are looking after your blood. They have nothing to do with your bowel. All right. And they go, I'm in the middle like a tennis ball being batted between them. But I have complete confidence in both of them because they've both experienced, well, one's so experienced that he's retiring this year, got a wealth of experience, and the other one's in his 60s and he's very knowledgeable. They're bringing in a couple of younger doctors who are going to support them and eventually replace them. I think one's already been replaced. The frustration of seeing a doctor you're not used to seeing is the inevitable question, as we were discussing this afternoon, is what medication are you taking? And you sit there thinking, if you turn back one page you'll find that it was all written down the last time I was here, and if you turn back 2 pages you'll see you wrote it all down the last when I was here the time before last. And if you, because they ask the same questions each time.
Going for a walk after you've eaten, about at the hour mark, go for a walk. It need be a very short stroll to start off with, and your blood glucose will regulate itself very simply. And that's a piece of advice I've never had from any member of the medical profession, again, astonishingly. And once you start to lower your weight, you start to get more interested in exercise. You know, walking is a very simple piece that everybody can do. You don't need equipment and you can just do it by going out your front door, but it's not the only thing that you could do with the same effect. I have a couple of friends who loathe walking but think swimming is wonderful.
And I just, luckily enough, my nurse, she actually looks after me a lot better than my doctor. And I go in there and we'll sit and we'll actually chat. And she'll ask me, you know, how I'm feeling, what's it like when I take my insulin. She suggests little things, you know, like just going shopping in the daytime. And I felt that she has made a difference to my health and wanting to get better, because she's took time to understand me and my problems first. You know, to realise that, you know, it's more than just giving out somebody a pill. Or saying, you know, like she'll say, you know, just you know, if you're going to smoke, just cut it down. You know, she's given me little guidelines, like gradually do this, not that's bad, stop it. This is like this, stop doing that. And like she understands, like, it's like, because of the size of me, like a lot of people automatically think you eat all the time. And it's like, it's not often that case. I mean, he actually eats like anything. I've never seen, you know, somebody eat so much. And it's like, how can he be the size he is? And what he eats and what I eat, how can I be my size? But I purely know now it's exercise that's going to get my weight down. And, you know, I'm not a junk eater. I like fresh food. I like vegetables, I like fruit. But when a doctor just looks at you, like my first doctor, and he says, all I can see is, because like I said to him, every week I went in with my diet plan, and he said, but you can't be eating that because of your size. And I said, well, why would I lie? I'm coming to you for help. I have no reason to lie. I want to change, you know. Yeah, I don't want to be this size, but obviously there's something wrong. That's why I was going to him. But it took, like, for him to find out more about me to make him realise that, you know, just because I'm a big girl doesn't mean I sit and eat all day. And like, I have exercise and I'd go out. I used to do a lot more exercise than I do now, which I will get back to. But it took that, you know, because at first he was like, oh, I'll just give you this pill and I'll just give you that. And it wasn't that. I think it took that little bit more for him, I think, to open it up and say, you know, you can treat this by doing this and doing that. But yeah, doctors are the scariest of things.
Have you got any unanswered question about diabetes? Say I could bring into this room now the world expert on type 2 diabetes. Is there any question you'd like to put to that doctor?
Well, I don't know what is type 2 diabetes. Is it a mild form of, is this type 2 or what? Or the people that on insulin, or that type what? 1 or 2? What's the difference? I would like to know.
The hospital to have their own website, own microsite, which would have maybe had links to where the useful information sources are, and where you can gain support, useful telephone numbers, you know, because it's easy to mislay a piece of paper, to lose a phone, maybe lose numbers. Basically have case studies on it, but, you know, show how people of different ages are dealing with it, so at different stages of your life, how you could be coping with certain issues that you might be facing, what predominantly happens to people on the main then. Again, you know, not taking the ideas from others, but basically linking to the right sources.
The doctor sort of gave me some information, but I just didn't understand it. You know, because I went out and bought myself a machine to prick my finger, and he's telling me that those machines don't really give true accurate readings, you know, like what the you know, when you give a blood sample at the hospital, that would be. But obviously you can't go to hospital all the time to have blood tests, you know, and he explained it. But I think if they gave you more paperwork, you know, literature that explained it, that might help, rather than them telling you and then you come out there and you think, God, what did he say again? You know, because you just forget.
I think that some form of a support group, so that people who are newly diabetic could meet together and talk about what's happening to them. I have a neighbour across the way whose mother's just become diabetic, and her blood sugars are going up and down quite a lot, and she's not sure why, and it's very frightening. Well, you can't really, it's difficult to go to a clinic and say, I'm frightened because of this. You can say that they're going up and down, but it's not really a British thing to talk about your emotions. So you can't say I'm frightened. And that's what it would be if you were doing it on a level where you're in a room with people who are similarly affected, by having conversation. That can be more reassuring than anything else.
But looking back at your experience of type 2 diabetes so far, is there anything that you feel like you could have done with more support on?
I would have liked to have had evening access to the GP. That would have been, or Saturday morning. That would have made my life much, much better. I had access to dietitians. I'm not sure that anything else would have really helped. It was about me not wanting to be helped, I think. But just from a physical point of view, certainly having I mean, you can't even pick up a prescription at my GP on a Saturday morning. You know, I've now got them arranged that they will take them to Sainsbury's. They go to Sainsbury's and I collect them there, because Sainsbury's pharmacy stays open till 9 or 10 o'clock at night, which is really useful, you know, when you work. So I think that, yeah, just that would have made a difference. It would have meant that I wasn't so worried about the effect on my working life. I think that would have eased that pressure. Yeah.
I was given a whole load of information which was too much to take in, definitely, and also because I was quite angry about being now a diabetic, I felt, when I went to hospital visits, I felt like a bit of a victim. So I actually stopped going for quite a long time. I had a bit of a, well, some of the nurses at one point said, oh, you know, this is Tina and she thinks she knows it all. And that was on one visit, and I didn't think I knew it all at all, but I was a bit, probably, my defences were up probably. So I just stopped going. But then I went to my doctors, and they hold diabetic like surgeries, I suppose, or clinics, and that was much better, having more of a one-to-one relationship with a diabetic nurse who I got to know. So it's a bit better that way. I think that my doctor is very understanding, but without being sort of patronising. So, I mean, she and also sometimes she actually asks me what I think should happen, how I think things should go, or not what treatment I should be having, but how I feel about things, which is quite important, because you are the person with the problem, and also my diabetic nurse, she's very aware of that, obviously, I am a diabetic, but she's very aware that I still work, that I have to fit in my family life, that I have to fit in things that crop up unexpectedly, so she's very good at sort of talking to me about that and giving me advice about how I could deal with different situations, but without being patronising, which is quite nice.
Know more about it. Still probably don't know as much as I probably could do, but it's been a constant learning curve, because there's always, I mean, in the whole process of me coming from hospital to home, there's been bits missed out that I've had to pick up on. That's the support, while you're at hospital, fantastic, they look after you, brilliant. The transitional phases, they're the bits where it gets a bit messy. It's where one's passing the beacon to the other, but the other's not really ready for it, or they're not fully aware of the situation.
Do you mean by that, when you left hospital, it was kind of a question of getting your notes to your GP?
I think that was faxed over.
Right.
But I think the phrase that came to mind for me was that they were winging it. They were basically, going on the fly. They were basically, looking at it as it came. And, to be fair, ever since I've left hospital, I've only ever seen my diabetic GP at my surgery once, because he only does 2 sessions a week, in the afternoons or mornings, and it's hard when you've got work commitments to try and take time off. I mean, my work's been really supportive. Whenever there's been an annual checkup thing or the need, then they'll give me time off to do it. So they're really supportive. But obviously, in terms of the surgery, everything, I've really, information-wise, I've had fantastic support from the diabetes specialist nurse at the hospital, at the clinic. They're the ones that have been the most helpful. If I've ever had any queries, they've got like an answer machine service, they get back to you. Excuse me.
But you're not really getting ongoing, regular checkups at the GP?
No.
Why is that?
I think from what I read and what I understand of the whole system, you can choose where you want to have your treatment for, and even though I don't know whether or not this is something that's based on what I've read and what I perceive of everything at the moment, the doctors purely registered us so they get some sort of funding, because I'm a diabetic specialist, diabetic patient under their care. Yet I'm not seen by them, I'm seen by the hospital. The only other things that I've really had are, the retinopathy scan, where they check whether or not you're getting the glaucoma. I had one of those letters from the NHS Trust, and I went to one of these walk-in centres where they had a mobile unit. But everything else has been through the hospital.
One of the problems seems to be that there's no total nobody seems to be looking after you as a person, as a whole person. As I say, the individuals I've met in the NHS have all been absolutely brilliant as individuals, the doctors, the nurses at every level. But there's nobody, when I was in hospital, sort of looking after me. So I was sort of bunged in a bed in a ward, and luckily I'm fairly self-contained. If I've got a book to read, I'm reasonably okay, and if patient line television may be expensive, but at least it gives you something to watch. But I mean, there was nobody, and I was surrounded in the ward by people with amputations in wheelchairs looking incredibly miserable, most of them somewhat older than I was, and people with coming in for, I was there for 6 weeks, but most of the people just came in for 2 or 3 days. People with coming in to have shunts fitted so they can have dialysis and all that sort of thing. And I mean, I was sitting there just looking at this and thinking, God. And also there was it was pretty clear, although nobody said it to me, that one of the possible consequences would be to have my foot amputated, and that was obviously, and I got suicidal basically. I mean, I was thinking of, you know, ways I wasn't going to walk outside and throw myself under a bus because it wouldn't be fair on the bus driver. But, you know, I got really bad. Luckily, one of the SHOs had a bit of spare time and got talking to me, and she helped a bit. She must have had a word with the registrar, because the registrar came back and sort of gave me some other options. But that was, you know, I was very depressed. And as I said, there's nobody, and even now, you know, I don't feel there's no member of the medical profession who's actually responsible for me as a whole. There's nobody I can talk to like this, you know. It would actually, I'm not saying this is, well, it probably is doing me good, but, you know, it would be nice if I felt there was somebody who could appreciate that I don't necessarily want to stay alive for 100 years if that means being miserable, if you see what I mean. And that seems to be the problem. Each individual bit of the health service treats the individual bit of my body which has got something wrong with it, but nobody's looking really at the effect on me, if that makes sense.